in about 1 minute, so please stand by. We'll be right with you. Hello, this is Dr.Kaplan, and I want to thank you all for sharing your lunch time with me. This is our first webinar. It's going to be one of many series of webinar presentations, and this replaces what we have done in the past, where we had a seminar at a venue like a hotel, and you and I had to show up at the same place at the same time, and it was a great exchange of information. But if you weren't there that day, you missed it. This way we'll be able to keep this communication going. So anyways, a lot of you may have already known me, but let me give you a brief biographical sketch. I grew up in Chicago and attended the University of Wisconsin for undergraduate and returned to Chicago for my medical school. I then moved out to California for 5 years of postgraduate surgical training at UCLA. I stayed affiliated with UCLA all these years and achieved the rank of Associate Professor of Surgery and directed resident physician training in facial plastic and reconstructive surgery at Harbor UCLA. All the while I was building my private practice here in Torrance for over 30 years. I'm board certified by 2 boards, the American Board of Facial Plastic and Reconstructive Surgery and also the American Board of Head and Neck Surgery. My in-office operating suite is accredited by AAAHC, which is the largest accrediting organization for outpatient surgical facilities. As well, I'm on staff at the 2 local hospitals. So what are we going to be covering this afternoon? Briefly, are there non-surgical alternatives to a facelift? What are the different types of facelifts? Who's a candidate? What age is it time to consider having one? How long do they take? What's the recovery time? How long do the results last? How much do they cost? What are the risks? And how do I find a reputable surgeon? Well, let's start with, are there non-surgical alternatives to a facelift? And the answer is yes. I do many of them. I get all the same magazines, newspapers, and see the same TV and hear the same radio ads. And there is a tremendous amount of hype going on out there. But let's explain quickly that facelifts lift. Non-surgical alternatives don't lift. For example, and these are things I do, neuromodulators, things such as Botox and Dysport. They're very nice for smoothing out wrinkles, but that's what they do. Injectable fillers, very good at filling grooves and smoothing things out, but again, they do not lift. I'm medical director of a laser center where we have lots of lasers, and I can tell you that lasers are wonderful for resurfacing irregularities in the skin texture or pigment, but again, they do not lift. And the big hype now is all these machines that either use radio frequency or they use ultrasound, and they show some very nice photos, but they're 6-week photos, and often there's multiple treatments at high cost to achieve very short-term results. So Bizarro sums it up very nicely in saying, I'm afraid you're going to need more than just a simple facelift. And what I'm using this for is to point out that the solution to the problem has to match the problem. So There are different types of surgical facelifts, and there's a lot of vernacular out there, and different surgeons use different words, but in my practice, I do 3 types of facelifts. A Minilift for earlier problems involving mainly the face, and the Wonderlift, which as the problems increase, now there are issues into not just the face, but extending into the neck, and the traditional facelift, which is successful at solving face problems and extensive neck problems. So let's talk about Minilift. Typically, the candidate for this is a younger age group. Earlier problems, such as maybe just a little bit in the mid-third of the face or the jawline or jowls. For example, here's a lady that you can see flattening in this area, and clearly there's jowls over here, but that's pretty much it. But the descent of that face makes it look sad. Here she is after a Minilift, and you can see what has been accomplished in this zone as well as in that zone. Here's another example, and this is a patient that been a patient of mine for many, many years. As a matter of fact, I think she's one of the people that found me when I first started in practice. And her personal philosophy was, do things when you first see problems. And I agree with her, because she kept doing smaller procedures that lasted quite a duration, but she didn't have to live with problems escalating. So you and I might look and say, why is she so concerned about this area? But this is what she wanted. And now that post-op photo is somewhat suspect. She is wearing a wig and there's quite a bit of makeup on, because she said to me going into her Minilift, I have to meet clients in 3 days, and I will meet them. And I thought, well, that might be a bit of a push. And she drove over to my office and showed up and said, I told you I'd be going to work in 3 days. And I said, well, as long as you're standing here, let me take this picture. And I did. Where are the incisions for a Minilift? Well, as you can see, that dashed line is in the hair, but we don't shave any hair, we don't cut any hair. We just take some rubber bands and basically braid a little hair up and braid a little hair down to make our way. And then the incision continues into that dashed line into the natural creases in front of the ear and ends right at the earlobe. So in most of our surgeries, we're hiding incisions when we can in hair or hiding them in natural creases. Here's Bizarro again. The eye face, formerly known as jowls. If you look at how he's shooting the picture, there's no way you can look good. And I and many of my plastic surgery colleagues have all experienced the same thing. We walk into an exam room and there's a person sitting there, and the first thing after hello is, look at my cell phone pictures. And my answer usually is, stop taking selfies, or if you insist on taking selfies, tip your head up, tip it to the side, and shoot from the downside so that you look like a fashion model. So, what's the Wonderlift? Well, a number of years ago, I started looking at patients that I was doing traditional facelifts on, and I said, many of them, the problems in their neck are somewhat early, and couldn't there be a way to limit the incisions that I was doing with a traditional facelift to make for lesser incisions but still get the type of lift I was striving for? And indeed, the Wonderlift accomplished just that. So here's a gentleman that has some issues in the jawline neck area, and here he is after surgery with things improved. Again, here's another patient, similar issues, and this is after a Wonderlift. By the way, all these photos are approximately 1 year post-surgery. Here's a woman that had issues, again, as you can see, in this area of the mid-face, the jawline, and a little bit under the chin. And indeed, the Wonderlift did solve most of her problems, but she also did have brow and eyelid surgery, which you'll see that many of these people do combined procedures. Where's the incision for a Wonderlift? Well, here we go again, hiding in hair, hiding in this crease. Now this dotted line here actually is behind the ear. It's not on the ear, but it was our only way of showing that for this slide. and that limited the incision. So, but my probably most important contribution has been the affordable, increasingly popular facelift clip, which after a few days of using it, most people put it on the potato chip bag where it belongs. So what about the traditional facelift, and how is that done? Well, that's for a person that the problems have escalated, the amount of descent of the lower third of the face and the neck has increased significantly, and now you've got to resort to a more substantial surgery to solve the problem. So here's a lady who you can see has some issues here, here, and into the neck. And here she is after a traditional facelift, and then to repair these bands, a small incision was made underneath the chin to repair the muscles that create those bands. And additionally, she had eye and brow surgery as well. Now, we're getting into more problems into the neck, as you can see here, but there's also structural support problems in the chin and jawline in this particular lady. So now to solve this problem, we had to do the traditional facelift, but we had to create structure by implanting a chin implant into the chin through a small incision right underneath here, and at the same time did some liposuction to get rid of the obvious, and then did a muscle repair there as well. And so we often have to combine procedures to achieve more successful results. Here's another traditional facelift with a little bit of liposuction under the chin. Here's more issues into the neck and of course into the lower third of the face, and she's had a traditional facelift as well as doing a little bit of eyelid procedure. Now the problems will escalate. Now we're seeing a situation where we have forehead, brow, eye, face, neck, and I apologize, the photo, she's not that red, but here's the real new deal here, which is look at all these textural changes and pigment changes due to extensive sun exposure. So to solve this problem, yes, we had to do a traditional facelift. Yes, we did brow and eyes, but to get the desired response of this to that, we had to resort to laser resurfacing. And I realize you can grab your face with your hands and you could pull this up and it would get smoother, but in reality, a lot of those textural changes are in the skin itself. And when we're doing any type of facelift, we're working in the superficial layer of muscle just beneath the skin, which functions somewhat as an elastic support. And when we operate on it, we tighten it, shorten it, and that creates the lift effect. So where's the incision for the traditional lift? Well, here we go again. Looks a lot like the Minilift, looks a lot like the Wonderlift, coming back up here, and now that incision continues further back into the hair, and again, no shaving of any hair, no trimming of any hair. We work right within the hair itself. And here's that, by the way, this would be the Wonderlift incision, and that would end right there. And then the traditional facelift keeps coming, and sometimes we have to take it this far back just to get more lift within the neck. So, some of the common questions that come up are, who's a candidate for a facelift? Well, you're a candidate for a facelift if you're looking at something that's bothering you enough to motivate you to come in for a consultation. But that doesn't mean you get a facelift, because, well, first of all, we have to do a health questionnaire, and we have to determine, is this individual healthy enough to undergo this type of surgery? And there's some people that are on anticoagulants for heart and stroke problems. Can they come off of those types of medications prior to surgery? If they can't, they're clearly not a candidate for surgery. And there's other medical issues. So often in an older patient, I will send them off to their primary doctor or a cardiologist for medical clearance. What age is it time to consider having a facelift? Well, this pops up all the time. And I can't tell you how many times I'll be sitting with somebody who's 46, 47 years old, and announces to me, I will have a facelift when I'm 50 because that's when you have a facelift. My response to that is, but if you already have the problem now, you're going to be living with it for several more years, plus the problem escalates. And if you go back to that woman that liked to jump on things at the beginning, you may be able to solve the problem earlier with a smaller procedure. So there is no age-related time. It's just a matter of how much of an issue are you looking at. How long do they take? Well, in my hands, a Minilift takes about an hour and 15 to an hour and a half. A Wonderlift or traditional facelift take an hour and a half to an hour and 45, sometimes as long as 2 hours. The time for both the Wonderlift and traditional lift are the same because when I'm doing the Wonderlift, I'm working through smaller incisions to get to those muscle layers to tighten them up, and it takes a little longer despite working through the smaller incisions. Recovery time, well, that photo I showed you of that woman at 3 days, that's remarkable. It's more like 5 to 7 days for a Minilift, more like 7 days for a Wonderlift, and maybe 7 to 9 for a traditional facelift. The most famous question all plastic surgeons hear is, how long does a facelift last? And everybody immediately blurts out 7 years. Why do we say that? It's a safe answer. Most people get that. Some people who have done better than that, and some people have stress in their life, they become ill, and the results may not last that long. But 7 years is a legitimate answer. I see people go significantly longer at times. How much do they cost? And these are, in my office, the fees. A Minilift is $4,750. A Wonderlift or facelift are the same at $7,500. The reason why they're the same is that in surgery, time is a cost factor, or complexity is another reason for why a fee would be higher. All of the surgery incurs an operating room cost, which is an additional $1,900 for the operating room, and then the anesthesiologist is an additional $624. What are the risks? Well, keep in mind that this surgery is done in a very superficial plane. It's not just the skin, but it's that superficial layer of muscle. And hence, there aren't a lot of big risk factors to the surgery. But anesthesia is the issue. And the way we mitigate risk in my operating room is, number one, I only use board-certified physician anesthesiologists. We do not do a general anesthetic where an endotracheal tube is placed down your throat. A paralytic agent is used so that they can then put you on a ventilator and breathe for you. We use a technique which is called MAC, Monitored Anesthesia Care. The anesthesiologist starts an intravenous, gives you certain sedative medications that allow you to be asleep but continue to breathe on your own. And while you're under that anesthetic, I do some nerve blocks, which then lowers the amount of anesthetic required. And that makes this a much lower risk procedure. So, factors in selecting the best surgeon. I'm biased towards that guy in the left-hand corner because I think he's got a lot of experience in the procedures you're interested in, because all I've done in my entire career has been face and neck procedures. I don't do any breast or body work or any hand work. Patient satisfaction and success rate are linked. Can you be 100% successful and have 100% patient satisfaction? Obviously not. But the way you can keep that rate high is to stand by your work. So for example, if there's a small revision needed, a tweaking of it, so to speak, you do it at no cost. And that keeps patient satisfaction up. Now, training is very important. I spent 5 years in just the head and neck region doing facial plastic and reconstructive surgery. Board certification is significant. I consider it a minimum. If you're sitting in an office and that doctor is not board certified in plastic surgery or facial plastic surgery, I think you're in the wrong place. But I consider it the minimum. Your doctor has to go beyond just being board certified. And we'll talk about that a little bit. I think teaching is very important. I spent all those years teaching resident physicians. These are doctors in their 5th or 6th year of surgical training, incredibly bright, ask challenging questions, and I've always said the more you teach, the more you will learn from your students. I think I've been humbled over all the years and honored to have the respect of my peers, and that I've had as patients, physicians, their spouses, nurses and their spouses and family members, and it's a true honor. But I think at the end of the day, the integrity and honesty and respect for you, the patient, that a surgeon renders is critical. So, do whatever it takes. So, some people have already submitted questions, and I'm going to start with those questions initially. And if indeed we have enough time, and you've submitted questions right now, we'll get to them. If we run out of time, I promise you we'll quickly respond via email. And just remember, we'll be sending out a follow-up email with a complimentary coupon for an appointment with me to review your concerns and answer your questions. And let's go through some of these questions that have already been submitted. First one was, how do I know I will not look odd or look overdone? I would say the concern about looking overdone is probably the number one concern I hear from all of the patients coming in. Unfortunately, most of the people that are seen in the entertainment industry are setting an incredibly bad example of what should look good. My job is to keep you looking like you. You're just asking me to solve some problems, whether it's jowls or necklines or a double chin. You're just asking me to solve that problem. You're not asking me to have you walk into a room and people ask, is that really so-and-so? So that is my job, to make sure you don't look overdone or unusual. And the next question was, should I get my eyes done at the same time? And some of those slides that I showed you already, I noticed that a number of those patients did do their eyes and brow at the same time, and the answer is it often is done, and it's perfectly acceptable, and it works very nicely to have only one recovery time. Next question was, will there be scarring? Well, there are incisions. I showed you where they're at. They fade very quickly, but for the first few weeks, the reason why we like to hide things in hair or in natural creases is because there is some color and fullness to the incisions, but they fade very quickly. Next question was, what questions should I ask another surgeon if I want to compare them with you? And I'd say, ask the same questions of everyone. But I guarantee you will get different answers, because there are a number of ways to solve these problems. And so you won't get the same answer over and over again. But at the end of the day, it comes down to, can you and the doctor get on the same page, and can you have mutual trust that you're in it together and going to get a good solution to the problem. Next question was about credentials. Why do I need FACS after my doctor's name? The American College of Surgeons takes into it only board certified surgeons in certain surgical specialty boards. It's just one more step in that credentialing process, and that means that your surgeon has gone further along that process. Next question, do you have your own operating theater? Yes, I do, and as I mentioned, it's accredited by AAAHC. which means that we fulfill all the requirements that the hospital or any freestanding surgery center does. How private is your surgery center? Very private. Matter of fact, most days that somebody comes in for a facelift, they're the procedure of the day. So there's not a lot of running around yelling your name out and checking. We know exactly who you are. You're coming into our operating room where there's 4 people taking care of you. There's Dr. Kaplan, there's a registered nurse, there's another physician, the anesthesiologist, and there's a surgical tech helping me do the surgery, which gets us to a ratio of 4 people looking after 1. I've heard about a new injectable product for a double chin, which looks horrible on a selfie. We had that Bizarro cartoon. There is a new product out. It's a desoxycholic acid, which has been around for a long, long time. It dissolves fat. When it was tried in various parts of the body before, it was a dismal failure. It's been resurrected now to have the double chin fat worked on. It takes anywhere between 3 to 5 sessions, roughly 50 small little injections underneath the chin to melt away the fat. Quite frankly, it in the end costs more than just doing a tiny bit of liposuction through an incision underneath the chin about 1/8 of an inch long, and that's a procedure done under local anesthesia. You don't even have to have any type of anesthesiologist. So I would say my prediction for this, what's being heavily hyped product, is there's going to be a disappointment. I think that concludes the questions that I'm seeing, and I want to thank you all again for sharing your lunch hour with me. If you got any good leftovers and you want to run by the office, I'm hungry right now, so I'm glad you all attended, and I look forward to perhaps going through this next month when we move on and move to brow lifting and eyelid surgeries. So again, thank you again very much. Hope to see you soon, and don't forget to follow up. I'd love to see you in the office in consultation, and we can get very down to specifics with you. Thanks again.